Knee pain is one of the most common injuries experienced by runners. That's because of the significant jarring forces which go through the knee with running, and also the cumulative nature of running. Any muscle imbalances or biomechanical imbalances can express themselves through tissue injury and pain. In this video, I'm going to let you know how you can check for these biomechanical factors and how you can do that through the simple use of a household mirror. I'm going to refer specifically to pain in one knee. Pain in both knees can occur because of biomechanical factors, but that's harder to check yourself. So you can, if you've got a full-length body mirror at home, then that's going to make this very easy. If you don't, you could try the fitting rooms of a clothing store, or alternatively get a friend or family member to take a photo of you. You want to get the body from about upper abdominal area down to the feet, and it's best to do this unclothed or in your underwear, and just roll your underwear down slightly, just past the bony point at the front of the pelvis on each side. So what are biomechanics? Biomechanics is simply how we're built and how that pertains to movement, our quality and efficiency of movement. And with the legs, there are three big things that we look at: leg length, shape of the knee, shape of the leg, and shape of the foot. So how do you check these? First of all, leg length. Look at the pelvis. So you can just eyeball it and see whether you feel like one side of the pelvis is higher than the other. You can place your hands on your hips, which essentially is around your waist. So you find the top of the pelvis on each side, that bony area there. Place your hands on your hips and observe whether one hand sits higher than the other. Another way to do it is to check the position of your arms. So if you have your arms just comfortably resting by your side, have a look at the space between each arm and the side of the body, and if there's a difference in the size of that gap between the arm and the body, then you could have a leg length difference, which would be best evaluated further. Moving on to shape of the leg. So what we're looking at here is angulation of the knee. So typically what happens is from the hip down towards the knee, our legs angle inwards, and then from the knee down to the ankle, it tends to be a straighter line. That can vary from person to person. What you're going to look for here is the position of the foot relative to the knee. So ideal scenario, nice vertical alignment of the lower leg, the foot will sit beneath the knee. It can sit either side, but what you're looking for is any difference between right and left. So that's that orientation of the foot relative to the knee. Do you see any difference between right and left? Next, the shape of the foot, and in particular the arch of the foot. This is called the medial arch of the foot. Where is that? That's the sole of the foot, or the inner surface of the foot. It runs between the base of the big toe towards the heel. This can be different from person to person. In standing, someone might have a high arch, someone else might have a low arch, i.e. flat feet. Just check a difference between right and left, see if there's anything noticeable there. There is a nice little bony prominence, which just below the point of the bony point of the ankle, on the inner ankle, there's a bony point there at the top part of the arch, and if you can see that, just observe where that sits. That'll give you a good indication of whether the arch is high or low. So that's probably the hardest of the three to determine a difference in, the arches of the feet, but it's worth having a look at. I mean, if there's an obvious difference, chances are that's a good possibility for causing pain at the knee. So those three things there, if you've noticed a difference between right and left, then that's a good starting point for you to take to your physiotherapist for getting this knee pain sorted. If everything looks good, if there's no imbalance, then that's great. You could have a muscle imbalance. That's the topic of another video. So if you are a runner and you've been suffering pain in one knee, then hopefully this will give you a bit of an impression as to whether biomechanics might be contributing to that, and you can take that further forward. And hopefully you've enjoyed the video. If you found it useful, then please share it on and give us a like. Any questions, put it in the comments section, send me a message. Thanks for watching.